1340 AM, Lumberton, North Carolina, the broadcast from live from the Nelson corner of Nelson building. We have three lovely ladies here today. Praise God. Southeastern Health Connection. Praise God. I'm going to turn it over to you.
Thank you so much. My name is Amanda Crabtree, and I'm your host for Southeastern Health's Healthy Connection. And the calendar is getting ready to get flipped on Sunday to October, and we are delighted to have Kat Gaines with us. She is a lead patient navigator and physician assistant, and shortly we'll be joined by Miss Wendy Christie. She's also a patient navigator and a physician assistant.
Yep.
And we're going to be talking about none other than October as Breast Cancer Awareness Month. And so
Woo-hoo.
we're delighted to have you back in the studio with us, Kat. It's always a good time. And something to talk about that you're passionate about all that you do, but we know that breast cancer, being females, we want to help raise awareness of our fellow women in the community.
It hits close to home. Yep.
It does, and there's lots of resources out there that we need to share. So let's talk about breast cancer screening. Let's start off with that, because
Sure.
we know that there's always some, what should we do, what's
Right.
the age, what's the magic age, how often. So what's the current recommendation for breast cancer screening?
Well, it's interesting. So there was a little controversy recently, by recently I mean about a year ago, that we needed to change it from ages 40 to 64 or maybe older, depending, and I'll go into depending in a minute. But it's definitely starting at age 40, and then how often starting at age 40 was what was controversial.
Mm-hmm.
Having said that, the American College of Radiology just did a back-to-back study against women who had mammograms every year starting at 40 versus women who had it every other year or every 5 years.
Mm-hmm.
The women in the every year after 40 group found their breast cancers much earlier with a higher cure rate.
Wow.
So that's really starting to push a lot of people back towards the
Mhm.
idea of, which is, in my opinion, and many radiologists and many GYNs, where we
Mhm.
should have left it from the get-go.
Right.
Which is starting at age 40. If you don't have any lumps, bumps, or anything else, or family history, that you should start your mammogram starting at age 40, and then every year until you and your doctor decide you no longer, that's not a risk you're no longer concerned about.
Mhm.
So that's where it looks like we're standing. Your insurance company will pay, and
Mhm.
that's the other big piece.
Mhm.
You know, what's insurance going to pay back? And
Right.
so that is what they are still covering at this point.
Great. And so we know that age 40, that recommendation you just talked about is, like you said, if you don't have any issues. But if you find, of course, we need to talk about
Oh gosh, yeah.
self
Yep.
screening too. And then if you find something, or if you're a practitioner, then there's another whole
Yeah, another whole
process.
ballgame there.
Yeah.
So this is all just for what's called a screening mammogram.
Mhm.
And a lot of women, it gets confusing, particularly with your insurance, because
Yeah.
love or hate Obamacare, when that came through, and right now it's still the law of the land, screening mammograms, number one, don't require an order by your physician, so anybody can call and get their screening mammogram done. But a screening mammogram is if we didn't find anything on exam. So if you haven't found any lumps on exam, if you don't have any changes in the skin, anything, no nipple discharge, anything like that, then yes, you need a screening mammogram. But if we find something, so if you found a knot you're worried about, if your practitioner found something that they're concerned about, then that's no longer a screening mammogram, that's a diagnostic mammogram. Now that is not under the Obamacare no copay rule. That means that if you have something like Medicare, which is 80-20, so if Medicare would pay 80% of that, that means that you are responsible for 20% of that bill. And that's a way a lot of different insurances work, but at that point you would have to pay a copay, and you might have to pay whatever percentage based on your insurance company.
Okay, and let me do a little plug here, because if you need the screening mammogram, you can call Southeastern Radiological Associates at 671-4000,
Yep.
easy to remember, and schedule that yourself.
Yep.
Of course, if you have these other issues, there's like you mentioned, a different process to go through, and there may be some out of pocket.
Right.
And we're going to talk about resources for that
Yes,
as
we are.
well, because there are a lot of things out there that people may not know about.
Right.
So if you are ready for your annual, or if something's been detected, talk about the different ways that screening takes place.
Well, and to
Those
say
steps.
that though you don't need an order from your physician or from your practitioner, I still think it's a great idea to see your practitioner or your physician every year to get that clinical breast exam. Now, self-breast exam used to be the thing, I almost felt like we beat people up with self-breast exam. Oh, you got to do your breast. Why do you mean you're not doing your breast exam? When we did a long-term prospective study, which is in medicine is a way to say it was a really good study, women who did self-breast exam weren't any more likely to find a breast exam than women who didn't. So quit beating yourself up about it. All right, just the main thing is please get your mammograms, and if you would, please at least once a year. It would be great if it was at least once a year. Go see your practitioner just to get a general exam.
And not just talking about breast health, but
no, that's
overall
all health, right?
At least once a year.
Yes. And when they do that, the things we can look for, number one, what's your cardiovascular risk as far as your risk for heart disease and stroke, which in this county is actually the number one killer. Everyone's worried about cancer. The number one killer is going to be your heart and stroke. And also, it would evaluate for diabetes, another big one in this community, but then your cancer risk as well. And it's not just breast cancer, but all those other things you might be susceptible to or might need screening exams earlier. All that you can talk to your practitioner about and start getting those things in place early.
Yeah. So that's very important. So ladies, everybody who's listening, if you haven't seen a doctor in the past 12 months, it's very important that you get that scheduled with the primary care physician.
Yeah, and since probably there's a lot of ladies out there, you realize you're going to have to schedule that for your husbands and your boyfriends because they're not doing it. We just have to take that responsibility. They just aren't going to do it. I don't know what it is about men and the doctor. But please, please, please encourage them or just make the appointment and drive them there to get them checked out because our men are lagging behind women in getting their screening exams.
That's very important for our loved ones.
Yeah.
So what are the different ways that we can detect breast cancer? And I know a lot of women are leery of the mammogram because they think it's going to hurt, I'm going to be sore,
right?
But that's not necessarily the case.
No, and so a couple things. One is that I don't want women who don't have insurance to not get their mammograms because we have programs in place for that, and we're going to touch on that in a minute. But there's many different ways to find breast cancer. Number one, if you do feel something when you're in the shower, if you feel something on your own exam, please don't wait. This is what we hear over and over again, particularly in the surgery clinic, is that, well, I felt this, a couple months ago, but I put it off. I was busy, I was this, I was that. Please do not put that off. Many a time, it turns out that nodule is just a nodule, and this way we can just keep an eye on it. But if it is something else, the earlier we find that cancer, the sooner I can get you cured. And I'm more likely to get you cured of your breast cancer than if we wait and wait and wait and that thing gets bigger and bigger and bigger. But that is almost, as women, we tend to just put stuff off. Oh, I've got kids to worry about. I got this to worry about. Please don't do that. Worry about the body that the Lord gave you because that's the thing that's going to help you take care of everybody else.
Absolutely.
So
and
that's
you
one
need
way.
To be there to help take care of your family.
Yes.
Yeah.
Now the other thing is that sometimes when you go in for your exam, your practitioner may feel something. Wendy and I have felt a couple times we've had women that we're like, I'm not sure what that is. Let's go ahead and get that diagnostic mammogram, and then we know what it is. But mammogram, far and away, has been shown to find more breast cancers than anything else. And mammogram, one after the other, is what's so important. So one mammogram is good, but the one following it and all the years following, now you've really got a way to go back and look at the previous mammograms, and the radiologist can really begin to make a good decision on, is that thing changing? Is it something? Is it not? That's where the strength of mammography comes in.
Got to have that baseline.
You got to have the baseline.
You got to lay the foundation and then to compare.
Right. It's the comparison that makes it such a strong test.
And so what if someone needs a breast ultrasound? Is that another layer or level of searching?
What happens all the time. So we'll have, just using myself, this year I had my screening mammogram and they found something, which of course, pins and needles till they pull you back in. And then I had the diagnostic. And ladies, I mean, I'm not Dolly Parton. But it is a little uncomfortable when you have your, but a couple things you can do about that. You can either take Tylenol if you're not allergic to it and don't have a contraindication a couple of hours beforehand and it helps. Or if you're not allergic and there's no contraindication, you can take Motrin about 2 hours beforehand and it does make a difference. So those are some of the things that you can do to decrease the discomfort, but it doesn't last that long. Yes, it is a little uncomfortable. Even the diagnostic I had was a little more uncomfortable, but I'm willing to put up with that to then get the radiologist coming in, sitting down with me and saying, it's nothing. Yeah. Thanks be to God.
Yes.
And
that is a sigh of relief.
I will go back in and have it done all over again.
Right. So, okay. So, and then there's some genetic testing that goes on. Talk about that.
Yeah, so we are getting ready to roll out. Everybody hears more and more about genetic testing, particularly with cancer treatment, but there's two kinds of genetic testing, and this is going to get a little confusing, so hang with me. There is genetic testing we do on known cancer tumors, and that's of the tumor itself, and that helps drive treatment. There's all kinds of fancy, amazing stuff we can do to tumors now to shrink them and to cure them. And that's different from familial, or in other words, do you have family history that makes me concerned that we may need to look for a genetic predisposition for something? And that, just think about Angelina Jolie. So she is the one that had significant breast cancer risk in her family. She got tested. It turns out she was positive for that gene, and at that point she had some decisions to make. So what it does, if we do genetic testing on folks, is gives the patient the ability to start making some decisions about their health care for the future to reduce their risk of getting breast cancer. And if they choose not to do surgery, which is fine, then their surveillance. In other words, we check them more often. So if we do find something, we find it super early.
Okay, and that's something that's coming. So will
It's coming.
OBGYNs begin to order that
Now,
testing?
your OBGYNs already do. A lot of them already do, not all.
Okay.
But at Southeastern Health, they are doing that now, particularly for the BRCA or BRCA1 and 2. But there's more panels that we can be doing, and that looks like that might be something coming down the pike. The other thing that Wendy and I are doing in the navigation clinic is we're starting to add that in as well. So we will, if you have folks that are concerned about their family history, and if you want to make an appointment, you can call us at 671-5357, and Miss Connie can schedule you an appointment. We can go over your family history, just do a basic well woman or well man check, and look at your family history, and then there are certain flags that would make us say you are a candidate for testing or not. And so that's something, if folks are interested in that, we can certainly do that too.
Is it always a first-degree relative, a mom,
No.
a sister, or is it could have been an aunt or a grandmother?
Right, and so you have to, and it also is based on background as just thinking Ashkenazi Jewish population. So there's not a tremendous number of Ashkenazi Jewish here in the South, but there are some. That group is at an increased risk for many things, and one of those things is cancer. And so if someone is a descendant of Ashkenazi Jewish and has any cancer in their family at all, they're automatically could, if they wish to, could go ahead and get genetic counseling. And again, most insurance companies cover this. Certainly Medicaid and Medicare do.
Okay. Just want to remind our listeners, we're talking with lead patient navigator and physician assistant Kat Gaines, and she is housed at Gibson Cancer Center, but she works in a number of different areas, and we'll soon be joined by Miss Wendy Christie, who also works with Kat, and we're talking about, on the heels of October coming up next week, breast cancer awareness. So got some great information. Some numbers want to share, just remind you, if you're interested in a screening, not
a
screening.
screening. Please don't screen
No.
during your mammogram. It frightens the other
A
patient.
screening mammogram at Southeastern Radiological Associates, you can call 671-4000. And then if you would share once again that number to the navigation department, people can get all kind of information.
And actually, this number will come up again and again because we're going to
Yeah.
talk about uninsured women in a moment. And then that number is 910-671-5357. And you'll be talking to Miss Connie, who will be thrilled and over the moon to talk to you and get you scheduled for whatever we need.
Great group, very passionate about what
Yes.
they do. And so, resources for assistance. We
Okay.
know that insurance coverage, Obamacare, however you want to look, Medicare, Medicaid, that's very complicated and hard to understand. And
It
some
is.
people don't have resources to pay for things like this, which are very needed. So, talk about BCCC and a lot of different resources that your group helps with.
Right. So one of our favorite acronyms for us is the BCEP program, or the
Yeah.
BCCP, which is the Breast and Cervical Cancer Control Program for North Carolina. This is a beautiful program that is partially funded by the CDC out of Atlanta, and then so that's federal funds, and then we have state funds from North Carolina that help pay for it as well. And the program, the idea of the program, is that women who are uninsured, particularly between the ages of 50 and 64, can get a free mammogram and pap smear if they do not have insurance. And so that's fantastic. Now, it will also do a free mammogram and pap smear for women who are 40 to 64, although they encourage us to get as many women 50 to 64 as we can, because that's where you're going to find a higher predominance of breast cancers and cervical cancers. But so saying that, it doesn't mean I can't see 40-year-olds, and we definitely do. Also, having said that, I have had some women who have come in, either to the emergency department or the health department, who have found a lump who aren't 40 and don't have insurance. We can help them too.
Okay.
And so any of those things, if you found a lump, first off, if you don't have insurance, don't despair. Second off, if you are between the ages of 40 and 64, give us a call at the 671-5357 number to talk to Miss Connie, and let's get you scheduled for that. And then if you are younger than 40 but you found something on exam that you're concerned about, then please again call that number, 671-5357, and we can get you scheduled and taken care of.
Sounds like that's a good number to have.
It is
if
a
you
lot,
have
yeah.
any questions or concerns.
On speed dial.
Yeah, great. Okay, and that's your department for patient.
That's our
navigation.
department, yes ma'am.
Okay, so what other screenings or resources are out there, or is that pretty much the filter through which you get them?
That's the filter through
Yeah,
which we
yeah.
start. And the beautiful thing about that program is that even for, so as for our women that are residents or citizens rather of the United States, we can definitely get them in and get them taken care of. Should it turn out that we find something, it will do the workup. It will go in and do the biopsies, it will do the ultrasounds, and we'll pay for all of that. The same thing for your pap smear. If you have an abnormal pap smear, it will do the workup to figure out whether or not you have cancer. In the case of 9 women out of 196 we saw last year, they were positive for cancer. Those 9 women converted to Medicaid. So they don't have to worry about becoming financially bankrupt because they got diagnosed with cancer. And that's where it's fantastic. Now, the only problem, the hitch, the Achilles heel of it, is if the women are not citizens, if they don't have a Social Security number, it will not convert to Medicaid. It will still pay for the workup and get them going, but it will stop at conversion to Medicaid if they're positive.
Okay. All right. So once someone's been screened, there's been cancer detected. We know there's different stages. If you find a larger lump or not, or it may not be anything. But talk about once it's been detected and
What
then
next?
it's stage. What's next?
Yeah. So basically what happens is what we're all hoping for is stage 0, and there is a stage 0, and that means it's so super tiny that it's just going to be fantastic. The cure rate is over 95%, yay! And that's why I really, really, really advocate and push these screening mammograms, because I'm more likely to find it in a lower
The
stage.
sooner you find it,
Right.
the
You
higher
really want to go
survival rate.
lower. So
Yes.
you go, the staging goes right now, although it might be changing shortly, but right now the staging goes from 0 to 4. The stage 0 means we've caught it before it spread anywhere. It's not even invaded any of the tissues around it yet. It is so tiny that and think of it almost like a seed from a daffodil. So it hasn't even spread yet. It's just, it's there. We've caught it while it's just barely a shoot coming out of the ground. Now, stage 1 and 2, the daffodil is kind of growing and it might be getting ready to become a flower, but we've still caught it before it's spread to the rest of your garden. So that's kind of the way you think of stage 1 and 2. Stage 3, the daffodil's bloomed and it's starting to turn into the little white seeds before it blows away. It hasn't blown yet, but the potential is there. And then stage 4, you think of the dandelion it's actually blowing the seeds into the wind and metastasizing, in the case of the dandelion, taking over the rest of your garden. But the same thought then for stage 4 in cancer is that it has spread beyond even local spread wherever it started and is now spreading to the rest of your body. And we want to get it when it's still a little root,
Right.
just popping out of the ground. We don't want it to get to the point where it's spreading its seeds all over your body.
Which is why it's so important to get the base mammogram
Yes.
so that the radiologist can see when that tiny, as you called it, seed,
Yep.
there's some small difference.
Right. And now there's so many different, it would be, because Amanda knows that I can talk forever, but that would be like a 4-hour talk about just about
Yeah.
staging and how we treat it, but there are so many things to treat now. There's anti-hormone medication that you can take that helps prevent it from coming back. There's just all kinds. Surgery obviously is still a mainstay. A chance to cut is a chance to cure, as my surgeons say, and love to say, because we can change women's lives by removing that cancer. And we can change their risk by then starting these other medications with oncology. The oncologist then will come in and say, you've got these different tumor markers that we talked about, those genetic tests that you do on the tumor itself, and there's medication that I can put you on that will prevent you from getting it somewhere else or getting another breast cancer in the other breast down the road. There's just so much out there now that we can do.
And and I can only imagine that when someone hears breast cancer diagnosis, everything just turns into a blur, which is why my segue is into the navigators, because I mean, I'm sure it's just a shock and your body's just, and so that's what you folks are for, is to help actually literally navigate these patients through this process, because I'm sure you don't really hear what else someone says at that appointment. So maybe you need to come back and let's talk about it after the initial shock is worn off. And so talk about your staff and the importance of navigation.
So patient navigation was started by Dr. Freeman, who was a surgeon in New York, who was just frustrated by the fact that the women he was getting, he worked in Harlem, that the women he was getting were all stage 4. So from a surgeon's perspective, you can't cut that out. So it's very frustrating. So he really believed that there were barriers, and he was right. There were barriers to women getting into the healthcare system, and then even in the healthcare system, there were barriers to getting through it, to getting to treatment. So he did a long-term prospective study. He actually was president of the American Cancer Society for a period of time, and he did long-term prospective studies that showed there are barriers, that the women who were that lived in Harlem were likely, if they had breast cancer, were likely to still be alive at 5 years about 39% of the time. And that's if they were African American. If they were white, they were 74% and lived anywhere else in the country. 74% of them would be alive. So it's a huge, I mean, that's huge. Striking, very striking. So he believed that if you put people at pivotal points in that healthcare system, that they could help push women through, and that you could shift staging. So that's the whole idea, is how do we, this is all really population health management, how do I get more people into screening so I can find it earlier, so I can stage it earlier, so we can cure it. And he's right. So, and as it turns out, he's right. And so they started this thing called patient navigation, and that's what my folks do. We do 2 things. We do 3 basic things. One thing is that we help people from the time of something might be wrong to something is definitely wrong, and to make that time as short as possible. Number 1, because you're freaked out. And number 2, because you have better outcomes. And it's been proven that if I can decrease that time from the time of, let's say, an abnormal mammogram till I know it's cancer, then you're going to have a better outcome. So we get you into treatment sooner, and that's the next piece. Is there any barrier to getting you through that healthcare system? Do you not have insurance? Do you have trouble with transportation? Do you have trouble with child care or elder care? Now, a lot of people are sandwiched between taking care of their elder parents and their younger children. Do you need help with that piece? And so that's where the rest of the team comes in. We have our social worker, Sharita Jenkins, helps with the social aspects of that. And then the other piece of it, if you're having issues with treatment as far as your nausea, vomiting, if you're having problems with your drains after surgery, any of that, then the navigator can help pull you back into your surgeon as quickly as possible to get that taken care of. Maybe answer a quick question, or maybe there's a question about how to do your medications. Then they can ask the oncologist. They can help get those answers for you as you're going through your treatment.
Okay, all right. We are delighted to be joined by Miss Wendy Christie, entering the studio now. Hi. She is also a patient navigator and physician assistant with the navigation program at Gibson Cancer Center. So we've talked about, and again we've got Kat Gaines return to the studio. She's always glad to have her. And so let's shift to what's going on throughout October. I know that there's a lot of events planned. We're going to all be wearing our pink, and hospitals going to be asking their employees to wear pink shoes, and we've asked our local businesses to go pink and decorate their business pink. I know Biggs Park Mall, when you walk through there in October, a lot of the stores go pink, Maurice's and a lot of those. So if you would, Wendy and Kat, tell us a little bit about some of the things that we have going on for the month of October, and so that our listeners can put it on their calendar and plan to be there.
Oh, yeah.
So a couple of things. We got some dates. If you got a pencil or a pen, you can write them down. We do a monthly walk with a doc. So in October, it'll be Thursday, October 19th at 11. Sponsored by Gibson Cancer Center. It's located at Biggs Park Mall.
In the Community Health Education Center. Yep.
Yes. And most everyone is welcome. A great informational session. Sometimes they'll have some snacks.
And then you have to walk, though. That's
and then you have to walk. So we, whoever is speaking that day, the quote-unquote doc will generally walk with all who are there. Lots of cancer survivors will attend these. It's a great way to fellowship and learn a little bit, and get out and see other folks. And it's free.
Yeah, it's great.
Which is great.
And then the other big thing is, of course, we're talking about cancer prevention, which obviously we want to do all the screenings, and we're going to highlight that, like all the screenings that need to go with that. But Wendy and I, as we preach, probably possibly a little too much, but we always like to preach the other things that you can do that you have control over that will decrease your risk of cancer, and one of those is walking,
exercise.
Yep. And so we like to practice what we preach. So the other piece to that is then eating healthy. This is a beautiful county with plenty of agriculture out there. We have farmers that are doing a fantastic job of creating this amazing food for us to eat. Please take advantage of our farmers markets. The more food you buy and take home and prepare yourself, you know what went into that.
Right.
So it decreases the amount of preservatives and other things that are going into that. And one of the things with cancer prevention we're really pushing with people now is try to eat out less. I mean, as a society, we eat out so much. I mean, I'm old, and back in the day, you never ate out. We dare. I mean, I seriously could count on one hand the number of times we ate out before the age when I was 12.
Yeah.
Just did it.
Yeah.
Mom had the whole. You knew what we were eating every day. I mean, it was planned. And so I think that's one of the things. It doesn't have to be hard when you think about changing your diet. Seriously, just don't eat out as much.
Yeah.
Yep. Save money, save inches in your waist,
Yes,
and try to help prevent cancer and a lot of other diseases like obesity and diabetes. So yes, so we try to go through all of that, and then again, like Kat said, practice what we preach. So we get together and walk together and talk about healthy things, and that's 11 a.m. on October 19th. Then Saturday, October 21st, an event on the weekend, 8 a.m. to 12 p.m., Pink Family Fun Day. This is sponsored by the Southeastern Fitness Center and Rehabilitation Center and Gibson Cancer Center, and will be held at Lumberton Senior High School soccer field. So there'll be events there that day, more education and promoting cancer prevention, and again, October is Breast Cancer Awareness Month, so we really focus on breast cancer.
Not that the other cancers aren't as important, but this is just the one where I'm really trying to push outreach.
Right.
That's
And then-
October.
And we're coming up on the end of the show, so we definitely want to plug your Biggs Park Mall event that's coming up on Friday, October the 27th, which is a two-parter.
Yes.
So tell us about the Friday-Saturday event going on.
So on Friday, October the 27th, from 5 to 7 p.m., and we definitely want to do this so we can reach our working women. It's outreach, so we're going to have all sorts of different social agencies there, and then we can also sign you up for a mammogram if you haven't had one, because the very next morning, starting at 8 a.m. on Saturday, October 28th, we're going to have Mammogram Madness. So at the Women's Imaging Center, it used to be next to what a lot of people still think of as LRA, but it's Southeastern Radiology Associates. Between them and the Women's Imaging Center, which is right next door to them on 27th Street, we're going to have the WOW van parked out there. If you haven't had your breast exam, we can get that knocked out. I'll be doing those that day. And then you'll step off the WOW van and go right into your mammogram. We'll make sure that you have insurance, that all that's been covered. If you don't have insurance, then we'll get you into our BSEP program. And we talked about the acronym. That's the program for women that don't have insurance. Now we can go ahead and do your breast exam there in the van, and then you'll step off right into a mammogram that day. We are hoping for 34 women to take advantage of that, but if we have more, we're going to try to fit them in. I mean, I would love to burst the seams at this, and if we could have 50, although I can hear Jeff Inman, who's the manager over there, pulling his hair out. But
that would be a good problem.
That would be a good problem to have. So
No,
definitely.
do you have to pre-schedule the Saturday mammogram, or can you walk in?
You can walk in, but we would
Okay.
prefer it if we knew
because
who
that
was
way
coming.
you can plan for insurance and all in advance. I'm guessing.
Absolutely.
Have
So if you could call, again, Little Miss Connie, and if you're over 40, go ahead, though.
If you're over 40, though, you can at any point in time call and make your own appointment for your
Yes.
mammogram.
that.
So from an
671
insurance
4000.
standpoint,
Yes.
you don't really have to worry about that too much.
Right.
So just call us.
Yeah. And we can get that in. But especially if there's a group of you, if like it's girls' day out, or afterwards you guys want to go out back and have a nice steak, whatever, but come on over and we can get that taken care of. If you call, though, if we can get it scheduled, that'd be fantastic.
Yeah.
And that number is 671-5357. Again, 671-5357.
And let me just recap that Friday-Saturday event. So
Yep.
Friday, October the 27th, from 5 to 7 at Biggs Park Mall. That's the Breast Cancer Health Fair. There's going to be refreshments and entertainment, health booths, lots of fun things. And then while you're there, you can pre-schedule for your mammogram on Saturday, October the 28th at Southeastern Radiological Associates. And they'll be doing those mammograms, and exams 8 to 3 on Saturday, October the 28th. So if you take nothing away from the show today, I think the most important takeaway is this phone number for patient navigation, because Connie can really navigate you through not only where you need to go and more information about these events. So that number again is 910-671-5357. So we're glad to have you again. My guests today have been Wendy Christie and Kat Gaines, patient navigators and physician assistants at Gibbs.